these children to breathe. Many of these patients will also have congenital heart defects as another finding. Possible treatments include mandibular distraction, that's surgically moving the mandible forward, or a mandibular advancement. Many of these children, though, have observed to have catch-up growth. So initially they will have a very small mandible, but as they grow in time, the mandible becomes less small and a lot of their breathing problems will resolve. So they don't necessarily have to have surgery. The next condition we're going to talk about is cleidocrinial dysplasia. This is a disorder of bone resulting in clavicular and dental abnormalities. Cleido means collarbone, and patients have small or absent clavicles. If you have small or absent clavicles, that is how the patient is able to turn their shoulders in, as seen in the picture. This is an autosomal dominant condition, and it's been linked to the CBFA1 RUNX2 gene found on chromosome 6p21. And this gene guides osteoblastic differentiation. Some other findings are large head, frontal parietal bossing, small face, the maxilla and the zygoma are hypoplastic. You can also see hypertelorism, broad nose, short stature, delayed closure of the cranial sutures, and then this one is the characteristic finding. They have multiple unerupted permanent and supernumerary teeth. The crowns and roots are distorted and they lack cementum. The treatment is very complicated. One option would be to do dentures. Another treatment could possibly be to expose the teeth you want to keep and orthodontically extrude them while extracting the supernumerary teeth that you don't want to keep. This is just an x-ray showing how severe these supernumerary teeth are. And you might imagine that this would be a very complicated treatment plan, trying to decide which teeth you're going to treat, removing the other supernumerary teeth, and then possibly trying to do some orthodontic extrusion to help the teeth you did want to come in be able to come in correctly. But you could imagine where this is a very complicated case, and you may not be able to extrude these teeth at all, thus some of these patients wind up with dentures. The next condition we'll talk about is perirhomboid or progressive hemifacial atrophy. This is a slow progressive atrophy of the soft tissue and muscles of half of the face. The cause is unknown, but the most recent theory is that it is an autoimmune disorder. The onset is usually age 5 to 15. It starts off subtly, but over time you can see wasting away of half of the face, which you can appreciate in the picture. This can progress from anywhere from 2 to 10 years, and then it tends to stabilize. Accompanying features could be seizures, skin pigmentation or vitiligo. Vitiligo is unpigmented skin, eye problems, or trigeminal neuralgia. Currently, there is no known treatment. Reconstructive surgery is an option after stabilization of the disease, and some drug experimentation has begun targeting the immune system. The last condition we'll talk about today is DiGeorge, also known as velocardiofacial syndrome or 22q11 deletion syndrome. And we mentioned this one at the beginning. This is an autosomal dominant condition, and it's linked to the area 22q11, which is on the long arm of chromosome 22. And the incidence is about 1 in 2 to 5,000. This is the most common syndrome associated with cleft palate. This is actually quite a long region of the long arm on chromosome 22, so you see a wide variety of expressions of this syndrome. Some features could include a long face and underdeveloped lower jaw. Other things that are common are hearing loss, heart abnormalities, learning disabilities, thymic hypoplasia. And a way to remember some of these features is CATCH, and you can think of CATCH22 because this is 22q11. The C stands for cardiac abnormalities. A is abnormal facies. T is thymic hypoplasia. C is cleft palate. And H is hypocalcemia and hypoparathyroidism. And as you can see over on the bottom here, this area in the chromosome codes for many different genes, thus deletions here can have many different expressions. That's all I have for today. We're hoping to have a online question and answer session after we've given a couple of lectures, so stay tuned for that information. Thank you very much and be well.
Thus, I